Okay, so today we're going to discuss all about the bacterial morphology, and we have also here the bacterial metabolism or metabolic activities. So we start our discussion with the bacterial morphology. So we have here the shapes of your bacteria under the microscope, and that's identifying here the shape of the bacteria under the microscope would also allow us then to describe your bacteria. So when we are reporting your bacteria, so eventually we could use these terms in order for us then to describe the morphology of your bacteria under the microscope. Okay, the first one, we have here the cocci. So when speak about the cocci, so those are the bacteria which are cocci or round or spherical in shape. For the arrangement, so they could have here the diplococci. So diplococci are round bacteria wherein they try to be in pairs. So dalawa. On the other hand, they're able to form also here in chain. You call that one as your streptococci. Then we have also here your staphylococci. On the other hand, those are bacteria, round spherical bacteria wherein they are in cluster or in bunch of grapes arrangement. On the other hand, able to form here a group of four. You call that one as the tetrad. And then we have also here the sarcinae when they are in group of 8 or more cell. On the other hand, bacilli are those bacteria which are spherical. Spherical is parang elongated. So when they are in pairs, you call that one as your diplobacilli. And when they are in chain, you call that one as your streptobacilli. Then we have also here palisades. So palisade are spherical bacteria wherein they are found here or they are arranged side by side. So isa dito, then sa taas isa. Then we have also here the cocobacilli are those bacilli bacteria wherein their length is much wider than their width. I mean to say medyo mataba siya compared with your simple na bacilli lang. Okay, then we have your bacteria which are spiral. So first one, we have your Vibrio. Vibrio appears here to have a comma shape. Okay, comma shape na arrangement. Or comma shape na shape, I mean. Then we have here your Treponema, your spirochetes. And they are described here as having tightly coiled. Okay, they are tightly coiled here. So medyo malapit-lapit isa-isa't isa ang kanilang coiling. Then we have your spirillum here will have a loosely coiled arrangement. On the other hand, we have also here the bacteria Fusobacterium. So it would have the fusiform. Sinabing fusiform, so one end would have here, it would have a pointed end. So pointed end, you always was your fusiform in the case of your Fusobacterium. Okay, now we go to the different staining reaction. So the first one, we have here the Grams iodine or the gram stain. Okay, the gram stain is actually the gram na pangalan is actually coming from someone who tried to introduce and develop this staining pattern. Okay, so the gram stain would differentiate your bacteria as the gram positive or the gram negative depending on their staining pattern. Okay, we have here the stain used for the gram stain. So the primary stain na ginagamit, we have your crystal violet. So from the word itself, the color that's your violet. Your mordant or your fixative, we have here your grams iodine plus your sodium bicarbonate. Okay, your mordant help your primary stain to be taken up by the cell membrane of your bacteria para kumapit ang stain natin. Then we have your decolorizer. Decolorizer here, we use the pure acetone, that's 100% acetone. And the counter stain used for your gram stain, we have your safranin, which is color red. Okay, so we have here the differential uptake and the staining pattern between your gram positive and the gram negative bacteria. So when you try to apply your primer stain, the crystal violet plus the mordant, it would allow the stained crystal violet here to be taken up by both your gram-positive and the gram-negative. Therefore, both of them will be color violet or blue in color. After that one, okay, so crystal violet, it depending on the procedure, but most likely this is 1 minute, this is also 1 minute, this is 30 seconds, this is just few dips lang ng slide natin. Okay, then after applying your mordant and your primer stain, you try to apply here the colorizer in the form of your pure acetone. So what will going to happen here if you have your gram-positive? So remember that your gram-positive cell wall is made of a very thick na peptidoglycan layer. And the peptidoglycan layer is a protein. So if you try to apply acetone for that, okay, it will form here coagulum. Magko-coagulate ang ating cell membrane ng ating gram-positive bacteria because again, they have a very thick na peptidoglycan layer which is made up of the protein. So pag nag-form ng coagulum, okay, what are you expecting for that? Your crystal violet here will not able to escape. And therefore, crystal violet will be trapped inside the cell of your gram-positive. How about with your gram-negative? So remember that your gram-negative cell wall is made up of a thin na peptidoglycan layer, but is made up of very thick na lipid layer. So if you try to apply your pure acetone, mangyayari nun ay it will eventually dissolve your lipid component. So pag na-dissolve ng lipid component, your cell membrane magiging porous. Sinabing porous, magkakaroon ng pores, dadaming butas. And because of that, pag nagiging porous na ang cell membrane ng ating gram-negative, ano mangyayari sa crystal violet? The crystal violet will going to escape, lalabas ang crystal violet. Whereas your gram-positive, again, your crystal violet here will be trapped within your cell wall of your gram-positive because again, because of the formation of the coagulum because of the application of your acetone. Okay, next one, if you try to apply your counter stain, which is your safranin, which is red in color. So when you apply here the safranin as your counter stain for your gram-positive, since hindi naka-escape ang primary stain, your safranin will not able to enter the bacterial cell of your gram-positive. Pag hindi siya maka-enter, meaning to say, ang na-retain na stain na color here with your gram-positive cell wall will be your color of your primary stain, which is your crystal violet. And therefore, you end up with the color here, violet or blue, for your gram-positive. It's because here, it try to retain the color of your primary stain. It try to retain kasi remember na trap sila within your bacterial cell because of the coagulum produced here upon application of your pure acetone. How about your gram-negative? So remember here, your gram-negative, upon addition of your decolorizer, it become porous, allowing the escape of your primary stain. So therefore, pag nag-apply tayo ng secondary stain, the counter stain, which is your safranin, your gram-negative cell wall, we're going to take it up. Kasi wala nang stain doon sa loob. And remember that your safranin is red in color, and therefore, you're able to retain the color of your secondary stain, and therefore, gram-negative here will be having, okay, the color of your secondary or counter stain, which is pink or red in color. So, pag nakita mo na red or pink na bacteria after gram stain, then you consider that was your gram-negative bacteria. On the other hand, the blue color here or the violet color is your gram-positive. How about here for the background cells here, like for example, your WBC, your IBC, your epithelial cells, and even your amorphous substance, they will stain here as a pink in color, and they would assume here the gram-negative. Okay, now we go to the next staining pattern. We have here your acid-fast staining pattern. So this is for your acid-fast bacilli. We're talking about your mycobacterium plus the partially acid-fast nanocardia. We'll discuss later on the nocardia. Okay, the acid fast bacilli here in the case, the acid fast bacilli in the case of your Mycobacterium tuberculosis, they have identified here as what we have discussed on our first topic that the cell wall of your acid fast bacteria would have a very thick na lipid component or the waxy component, and you call that one as your mycolic acid. Because of that, they were able to resist decolorization if you try to add here your acid alcohol. So, pag sinabing resist decoloration, hindi sila mawawash off if you try to add your acid alcohol for that. Okay, there are two methods here for your acid fast. One is your Still-Nielsen. We consider that one as your hot method. It's a hot method because you try to apply, if you apply the stain, to try to heat that one. The Quinones, on the other hand, is a cold method wherein wala siyang ina-apply na heating process. The heating process would allow here also that allowing your primary stain to be taken up by your cell para hindi siya mordant, para allow ang primary stain for you then allow the primary stain here to be taken up by your cell. Okay, so we have here your Still-Nielsen and we have the Quinion method and we have the relative result with the acid fast bacilli versus your non-acid fast bacilli. Okay, the primary stain for both your Still-Nielsen and Quinion, we have your basic fusin. Basic fusin here is red in color. And you are also adding phenol in order for that then to be taken up. Aside from your basic fusin, phenol, so pag Still-Nielsen, i-heat mo siya para mag-penetrate ang ating primer stain. Or if you have your Quinion, wala na siyang heating process. After application of your primer stain, both your acid fast bacilli and even your non-acid fast bacteria would have color red here because of the color of your primer stain, which is basic fusin is a red in color. After that one, you try to apply your acid alcohol as your decolorizer. For the acid alcohol here, for your Quinion method, it makes use of the 3% acid alcohol. It's acid alcohol because made up of your hydrochloric acid plus your 95% ethanol. Okay, then we have here your Quinion naman. It makes use of the acid alcohol at concentration of 1%. Okay, that's your hydrochloric acid and 70% ethanol. Okay, so again, upon application of your acid alcohol here, your acid fast bacilli, in the case of your Mycobacterium tuberculosis, remember again that it would have a very thick na mycolic acid. Even if you add a strong acid, we consider the acid alcohol here as a strong acid. Even if you try to apply here the acid alcohol, they will not be decolorized because they have a very thick mycolic acid. Pag hindi sila ma-decolorize, we're able to retain the color of your basic fusin as your primer stain. Hindi lalabas o hindi mag-escape ang ating basic fusin here as being applied as a primer stain for your acid fast bacilli. For your non-acid fast bacilli, because this is a strong acid, ano mangyayari? So therefore, masisira ang kanilang cell wall if you try to apply here your decolorizer. Because again, this is a very strong acid. And therefore, they will be decolorized. So pag na-decolorize, lalabas ang ating primer stain for them, your basic fusin in your non-acid fast organism or bacteria. Then you try to apply the counter stain in the form of your methylene blue. Okay, the methylene blue here is being used for both your Still-Nielsen and your Quinion. Okay, so in the case of your acid fast bacilli, even if you try to apply your counter stain, they will not absorb here or they will not penetrate here the cell wall of your acid fast bacilli because again, they try to resist the coloration and try to trap here the color of your primer stain. And therefore, walang effect si methylene blue natin. Okay, and therefore, ano yung expect natin? Since di makapasok si methylene blue, ang color pa rin niya ay red ng acid fast bacilli. How about for your non-acid fast bacilli or bacteria? For the non-acid fast na mga organism here, bacteria, so since after the colorization process, the primer stain has escaped already, so upon addition of or application of your methylene blue, it will take up your counter stain. Kasi wala sila kanina, wala na silang stain after your decolorization. And therefore, they will attain or they will um, retain the color of your methylene blue as your counter stain. Therefore, there will be color blue here. So for our interpretation, Acephalus bacilli in the case of your Mycobacterium tuberculosis will be color red with your Acephalus staining, whereas your non-Acephalus bacteria will be stained blue after your staining with your Acephalus. Okay, then we have also here your nocardia. Okay, the nocardia on the other hand, we consider this one as a partially acid fast bacteria. It's partially acid fast because comparing that one with your Mycobacterium tuberculosis, this one would have a short chain of your mycolic acid. And this one, during the staining process, make use of a weak acid instead of the acid alcohol na at a concentration of 3% or even 1%. You try to use here your weak acid at a concentration of 0.5 to 1% sulfuric acid. Okay, ano mangyayari? Like for example, if you try to stain nocardia with the usual na acid fast staining. Okay, kung ito gagamitin mo, like for example, you are only after of the Mycobacterium tuberculosis, but ang presence sa ating sample here is the nocardia. At ang ginamit mo na decolorizer will be the strong acid. Pag strong acid ginamit mo sa nocardia, your nocardia will going to behave this way. Okay, so madidecolorize din siya ng ating acid alcohol, and therefore nocardia will give here a blue na color. Para siyang nagiging non-acid-fast because it was very strong acid as your decolorizer, and therefore it will try to dissolve here its mycolic acid. Therefore, when you are suspecting here for the presence of your nocardia, of course here you need to correlate mga medical conditions, signs, symptoms ng patient natin if you are suspecting for the nocardia. So, if you are using nocardia, if you are suspecting for the nocardia, so gagamit ka ng weak acid lang, sulfuric acid, 0.5 to 1% as your decolorizer. Kung itong ginamit mo na decolorizer for your nocardia, ganito pa din siya. Primary stain nito ay still your basic fusin. Pag nocardia ito, okay, basic fusin here will be taken up by nocardia, magiging red siya. If you try to add your as decolorizer, again, this time we'll be using here 0.5 to 1% na sulfuric acid. Pag yan ginamit mo, nocardia will not decolorize. How about your ordinary na mga bacteria? Even if you use here weak acid na 0.5 to 1%, pag ordinary bacteria yan, not your nocardia, still madidecolorize pa din sila. So again, pag ordinary bacteria, even if you use here a strong acid, acid alcohol, or weak acid na 0.5 to 1% sulfuric acid, madidecolorize sila. But for the nocardia, ang nocardia ay madidecolorize siya pag strong acid, which is the acid alcohol, but it will not decolorize if you are using here 0.5 to 1% sulfuric acid. So kung sulfuric acid ginamit mo, ganito magiging staining pattern ni nocardia natin. Pagdating dito, weak acid na 0.5 to 1% sulfuric acid, it will not decolorize your nocardia. And therefore, if you add here methylene blue, it will not be taken up by your nocardia. And therefore, nocardia will still have your stain red pa din siya at the end. That's your partial acid fast staining with your nocardia. Okay, we have here other bacteria which are considered to be acid fast. We have here Rhodococcus. Then we have also here the Cryptosporidium, Parvum, and we have your Isospora belli. Those are your parasites, which could be stained here by your acid fast staining. Another one, we could also use here fluorescent stain, okay, for your acid fast staining. The fluorescent stain used here for the acid fast staining, we have your auramine and we have your rhodamine. That will eventually try to stain your acid fast bacteria here as yellow or orange. A very bright yellow or orange, which is fluorescent na color here. Okay, then we have here again for the fluorescent stain. So for you to visualize this one, if you're using the auramine, rhodamine stain here, so this is our fluorescent stain, then you need to identify this one under your fluorescent microscope. Hindi tayo gagamit ng ordinary microscope for you to visualize this one, but rather You need to use here your fluorescent microscope for you to visualize that one. On the next stain, we have your acridine orange. Acridine orange would just identify for the presence of your bacteria in your clinical specimen. So this I use here for identification bacteria in your blood culture. Okay, so just have the positive result na bright orange. So that will signify here the bacteria. So sometimes the specimen, sobrang madaming background kasi pag gumawa tayo ng smear natin, madaming background ng smear natin. So just need to find kung may bright orange. So kung may bright orange mean to say the patient would have the presence of the bacteria. It will not differentiate gram-positive or gram-negative, but it will just identify the presence of your bacteria in your blood culture. Blood culture, you're collecting blood from the patient. So, pag may bacteria, so eventually, it will signify the patient would have the sepsis or infection in the blood. Another one, we have your methylene blue. Methylene blue here is stain used for identification of the metachromatic granules of your Corynebacterium diphtheriae. India ink is a stain for the presence of your capsule. So we have here your Cryptococcus neoformans. You could also have your bacteria na may capsule. We have your Bacillus anthracis, Streptococcus pneumoniae, and we have your Klebsiella pneumoniae. We have discussed this already. So if you are using the India ink, it's a negative stain. Pag sinabing negative stain, ang capsule mo walang color against your bacteria cell na may color. So, baga yung background mo ng capsule para siyang clear area lang. So, it's a negative stain. So, pag negative stain, walang color, that one is positive. For identification of your capsule against a colored na bacterial cell. Then we have here the endospore. Okay, so you could use here your malachite green na stain, then 5 minutes boiling or heating process, then you add your counter stain na safranin. So, endospore ay makikita sa gitna ng cell natin ng spore, di ba? Dito. So, your spore here at the middle portion, it would have here a bright green na color. And the bacteria, all the rest bacteria cell here would be red in color.